The umbilical cord is said to be prolapsed if the membranes are ruptured and the umbilical cord is palpable caudal to the presenting part of the fetus, as seen here. If an umbilical cord is prolapsed, immediate action is required, as fetal hypoxemia may develop rapidly, secondary to direct compression or vasospasm of the cord. Help should be summoned by the assistant, and a paediatrician and, if needed, an anesthesiologist should be notified. The fetus should be delivered as soon as possible via caesarean section or assisted vaginal delivery, depending on the fetal heart rate, the degree of cervical dilatation, and the descent of the presenting part. If the cord protrudes outside the vagina, it may be repositioned internally in order to prevent vasospasm secondary to reduction in temperature. Care should be taken not to induce cord spasm through excessive manipulation. To reduce the pressure on the umbilical cord prior to delivery or caesarean section, the presenting part of the fetus may be manually elevated by inserting 3 or more fingers into the vagina and lifting the presenting part above the level of the pelvis. An additional maneuver to allow elevation of the presenting part is Vargo's method. This involves filling the bladder with saline solution, resulting in elevation of the presenting part. For a more detailed elaboration of how to fill the bladder, please refer to the course Urinary Catheterization Female. Once the balloon of the catheter has been filled with 10 milliliters of saline solution using a syringe, the catheter is connected to a bag of saline using a connecting piece. The bladder can now be filled with 500 to 750 milliliters of saline solution by squeezing the bag of saline. The filled bladder will result in the cranial displacement of the fetal head, releasing the pressure on the umbilical cord. Once the bladder is sufficiently filled, a clamp is placed on the tubing in order to prevent backflow of fluid from the bladder. The patient is transported to the OR in a Trendelenburg position, while manual elevation of the fetal head is performed simultaneously. Manual vaginal elevation of the fetal head should be maintained until expedient delivery can take place. In the event of an umbilical cord prolapse where the fetal head is already deep within the pelvis, vacuum-assisted delivery is performed rather than caesarean section. The vacuum cup is placed on the fetal head. A vacuum is created and manual traction is applied to deliver the fetus. For a more detailed elaboration of vacuum-assisted delivery, please refer to the course Vacuum-Assisted Delivery.